Thanks, Janelle. As Janelle said, I'm Steve Barnett, Director of the National Institute for Early Education Research at Rutgers and co-chair of the Big Ten Early Learning Alliance, along with Laura Justice of Ohio State. I'm thrilled you can all be here today for our webinar on the state of preschool in the Big Ten states. So today you're going to hear first from my colleague, Allison Friedman-Krauss, um, and then from officials in three of the Big Ten states. Um, we're going to dig into details in each of those states. They're all different. They're all doing great things. They're all, I think, provide examples that other states can learn from. So this is going to be very exciting. We're going to, after Allison, we'll start with Stephen Profiter. He's director of the Early Education Department in the California Department of Education. Next, we'll have Emily Laidlaw, Deputy Director for Early Education in the Michigan Department of Education, of Lifelong Education, Advancement and Potential. And then this will be rounded out by Kimberly Villotti, who's Chief of the Bureau of Early Childhood in the Iowa Department of Education. Following the presentations, we're going to have a little time for Q&A. I think we have the chat working so that if questions come up along the way and you want to get a head start and put them in the chat, I will try to keep track of that. But each presenter will have about 10 minutes. I'm going to get us going quickly here by turning it over to Allison.
Great. Thank you, Steve. I'm going to go ahead and can people not, sorry, before I get started, there are some comments in the chat about okay, seems like audio is working. We'll get started. Can everyone see my slides okay?
Yeah.
Great. So thank you, Steve. And thank you again to Steve and Emily and Kimberly for being here today. We really appreciate you taking the time to do this with us. So I'll try to keep it short so we can hear from our friends in California, Michigan, and Iowa. Today I'm going to cover some brief highlights from the 2024 State of Preschool Yearbook, which covers the 2023-2024 school year. I'll highlight some national trends as well as what's going on in the Big Ten states. And this work was funded by the Heising-Simons Foundation and the Bill and Melinda Gates Foundation. For those of you who are less familiar with NIEER's annual State of Preschool reports, these reports are based on annual surveys of all state-funded preschool programs in the country dating back to 2002. It's the only report that tracks annually, state by state as well as nationally, investments in state-funded preschool programs. The survey and the report focus on enrollment, spending, as well as preschool policies to support quality. The 2023-2024 school year was a good one for preschool. States set new records for preschool enrollment and for spending, and some of the Big Ten states really contributed to this progress. So nationally, we reached record highs in enrollment, both in terms of the number of children and the percentage of children enrolled. States enrolled more than 1.75 million children, including 37% of 4-year-olds and 8% of 3-year-olds. Nearly 40% of children enrolled in state-funded preschool nationally attended preschool programs in the Big Ten states. As you can see here, the national pre-K enrollment has rebounded from the pandemic. So the blue solid line show the national trends, and the purple dotted line shows the enrollment trends in the Big Ten states. Nationally, as I mentioned, we've surpassed where we were before the pandemic, but preschool does continue to be a program mainly for 4-year-olds. And despite this progress made nationally, there is substantial variation across states, with some states like California moving rapidly ahead and making lots of progress, moving the national trends forward, and other states making little or no progress at all. 5 states continue to not have any state-funded preschool programs, though none of those 5 states are in the Big Ten. And while there is much to be celebrated this year in terms of our progress in preschool, we are quite weary about what it will look like in the future. Zooming in on the Big Ten states, this figure shows enrollment in the fall of 2001, so our first time point in those light blue bars. The medium blue shows fall of 2019, which is our last data point before the pandemic, and then the fall of 2023, which is our latest data point in the darkest blue. So you can see for each state in the Big Ten how the states have progressed from the when NIEER first started tracking enrollment through the pandemic and then how they have or have not recovered from the pandemic. California, with their rapid expansion of TK, stands out both nationally and in the Big Ten as a state moving ahead and helping to shift the national landscape. Michigan, Oregon, Ohio, Washington have also increased their enrollments to higher than pre-pandemic. On the other hand, preschool enrollment in states like Maryland and Wisconsin continued to be lower than before the pandemic. We're going to zoom in a little bit further and look at just full day pre-K. So many states offer only part day programs, full day programs, or some combination. But full day programs offer benefits, including for children's development and learning, but also for parents' abilities to work. Within the Big Ten states, as well as nationally, we see quite a bit of variation in the percentage of children who attend full day state funded preschool programs. The light blue bars here show our pre-pandemic data point, and the dark blue bars show what the story looks like now. So there are some states like Maryland, Oregon, and Washington that have made a lot of progress in the last 5 or so years in shifting away from part day slots and into full day slots. Michigan's also made a lot of progress, though their progress sort of predates the pandemic, so you don't see it on this slide. California's data only represent the California State Preschool Program, and it doesn't include California's Transitional Kindergarten Program. So it doesn't really reflect the full landscape of what full day pre-K may or may not look like in California. Turning now to spending, as states increased enrollment in preschool, they also reached record highs in spending on preschool in the 23-24 school year. They spent more than $13.6 billion in state funds, which was a nearly $2.2 billion increase from the prior year. The Big Ten states spent about $8 billion, or about 57% of all state funding on pre-K nationally. In 2002, they were spending about 44% of all spending nationally. So we've seen growth in that area in the Big Ten states as well. We also see here that when you add in local and federal dollars that states can report they use to fund preschool, that total reaches $15.3 billion. And with enrollment, spending and increases in spending also vary widely across the state. So for example, there are 7 states, including 3 in the Big Ten states, that increased spending last year by more than $100 million. So those were California, Maryland, and New Jersey in the Big Ten, and then Colorado, New York, New Mexico, and Texas outside of the Big Ten. And together they accounted for 3/4 of the increase. And I should have mentioned this before, but to just orient you to this figure, those solid green lines show the national patterns and the dotted blue lines show the Big Ten patterns. We also look at how much states spend per child, which varies substantially across the states. And so this slide shows our all reported spending metric, which we've adjusted for cost of living in the state because the dollar doesn't go as far in some states as it does in the other. So this tries to sort of equal it out. Nationally, when you look at state, local, and federal dollars that go into pre-K, it was almost $9,000 per child, but this ranged from $3,000 in Florida to $20,000 in DC. Within the Big Ten, we also see variation. I've highlighted the Big Ten states in that turquoise color, darker blue. Oregon, Maryland, and New Jersey are at the top of that pack. Another way we looked at spending this year is we estimated what it would take for each state to fully fund a high quality program meeting all 10 of NIEER's quality standard benchmarks, paying teachers on par with elementary school teachers, at the program's current operating schedule. So if they're providing a part day program, we're estimating what that would cost. If they're providing a full day program, we're estimating what that would cost. And so only 13 states and DC are estimated to spend enough for quality preschool in their states. Those are the states on this map in the darkest green colors. And as you can see, 7 of those are in the Big Ten states. So we have Washington, Oregon, California, Wisconsin, Nebraska, Maryland, and New Jersey. On the flip side, if you look at the map and you see those darker orange, red states, those are the states who have a lot more they need to do in order to fund preschool adequately. And so some of these states have to more than double what they're spending. And lastly, I'll just touch on quality. NIEER assesses each state-funded preschool program on a set of 10 research-based policies for quality. These are what we consider the minimum needed for a quality program. Things like requiring a teacher to have a bachelor's degree, having supports in place to support curriculum implementation, limiting class sizes to 20 children. Nationally, programs range from meeting 2 to all 10 of the benchmarks. Within the Big Ten states, Michigan's the only program to meet all 10 states. New Jersey, as well as one program in Washington, meet 9, and several programs do meet 8. Unfortunately, in the last few years, we've seen trends away from states investing in quality, and we've actually seen states moving in the opposite direction that we'd like to see them. And with that, I thank you for listening, and feel free to visit our website or reach out to us for more questions. And with that, I will turn it over to Stephen to share a little bit more about California.
Excellent. Well, thank you, Allison, Stephen, Janelle, Kathy, and Shelley, and the team at the Crane Center. Really appreciate the opportunity to be here as part of this panel of state leaders and to share some of California's story. We framed this as a journey because it really has been. We've been fortunate to have leaders in our state who have been working on bringing UPK to California for decades. So as part of my presentation, I'll be sharing a little bit about some progress, opportunities, strategies, some enrollment data, and things that we've learned that we think may be helpful for other states. Next slide, please. All right. So in thinking about the progress that we've made, funding is a big part of making UPK work. So on that front, we do have some great news. We are a state that's in a significant budget shortfall, but we're fortunate to have leaders both in our legislature who's appropriate funding and our governor to continue our transitional kindergarten expansion such that in this fiscal year, it is the full year of implementation. So every child who turns 4 by September 1st has access to, families can choose any number of programs, but they have guaranteed access to transitional kindergarten as part of our state's education guarantee. So what that looks like in terms of dollars, it's about $6.2 billion for early education, which includes about $3.3 billion for our universal transitional kindergarten, and then $2.9 billion for our California State Preschool program. It's big dollars, but there's a lot of kids in California. In comparison to where we were prior to this transitional kindergarten expansion, it's about $4.1 billion in terms of an increase. And we're happy to say that this year, California is increasing the TK program quality from 3 NIEER quality benchmarks to 4. So we're moving in the upper direction. And we hope to continue on that. So, and the way we did that is implementing a 1 to 10 adult to child ratio in transitional kindergarten. Next slide, please. So I mentioned that we're implementing universal pre-kindergarten for all 4-year-old children this year through our TK program. It's possible because of significant investments. How we got here is when Governor Newsom came in, his administration came in, he commissioned a master plan for early learning and care, which contained a number of recommendations. But among those to support school readiness were to have universal pre-kindergarten for 4-year-old children, as well as have targeted universalism for 3-year-old children by increasing enrollment of children from families from low-income backgrounds, as well as children with disabilities. And just to distinguish the two, 4-year-olds, our transitional kindergarten is only 4-year-old children. Our California State Preschool program includes 3, 4, and for a limited time, 2-year-old children. And let's see here. As part of the implementation, to make this successful, we knew planning was necessary. So our legislature and governor appropriated about $500 million for LEAs to plan for implementation, and then we got about $55 million spread across 3 years for expanding access across the mixed delivery system. So not just in our local educational agencies, but in community-based programs as well as family child care home education networks. Next slide, please. All right, so enrollment, where do things look now? So the total, I'll start first with kind of total enrollment that we have in our California State Preschool Program and Transitional Kindergarten. And this is unduplicated because there's a little provision in our State Preschool Program statute that allows for enrollment of transitional kindergarten age children for a certain segment after the instructional minutes requirement that's part of our school day. So it's about 278,000 total between the two UPK programs that our department oversees. So we've got a visual representation here, though, of how TK enrollment has changed from 2020-21 through 24-25. The orange line represents the estimated number of eligible 4-year-olds during each school year. And then the blue line represents the actual enrollment of children in TK during each school year. So we could see that starting in 2021, we enrolled just over 68,000 children. And in last year, 177,000 children on census day. So that's not cumulative enrollment. That's at a point in time during the school year. So we increased our percentage of eligible 4-year-old children enrolled in TK from 15% to 39%. And then, I'm sorry, ultimately to 54% last year. And we're already hearing from a lot of our programs that they are near capacity, maybe beyond capacity. So that number is going to be even bigger after we look at the 25-26 data. Next slide, please. So this is our state preschool program enrollment. You can see over a similar trend line over the last 5 years. One of the things that I would just point out is as we've seen more 4-year-olds move into the transitional kindergarten, naturally, we're seeing fewer 4-year-olds in the California State Preschool Program. So when we look at it may be a little hard to tell, but the blue and the orange really indicates 3-year-old enrollment, and orange is 4-year-old enrollment. But we see that 3-year-old enrollment and the share of 3-year-olds in our state preschool program increasing. Next slide, please. So in terms of challenges that we're facing either in sustaining or improving preschool programs, I think number one is local control. And for states that have where schools are independent or they have local control and there's limited things that states can require, I think that's one of the challenges. So what that just means for us is that we have to work creatively, work with partners in building systems that support developmentally appropriate practices in universal pre-K. So, one of the big things that we've been working on is curriculum and environments for TK programs. So we have UPK coordinators in nearly all of California's 58 counties. But those UPK coordinators have been key partners in getting out that messaging and helping districts to think about and, where they may not already know what developmentally appropriate practices look like. There's a few other things that we have that we've done to support developmentally appropriate practices. So when the TK legislation came out, we were also charged with updating our preschool learning foundations, which are, just another way of saying it's our standards without calling them standards, because there's a state board process that would require them to be adopted as standards. So they're foundations, but we updated those foundations in such a way as to reflect a year of pre-K in a school setting. So that was a big thing. And then there's a number of other things that we've done to support I think across UPK in terms of thinking about materials that programs may need when they're serving younger children in different settings, because that really happened. We saw more 3-year-olds in state preschool, younger 4-year-olds in school settings. And, you know, the thing that most folks were worried about when we first rolled out the TK expansion are bodies and potties. We ended up coming up with a toileting toolkit to support, you know, our educators who were dealing with things that, you know, they frankly weren't dealing with an older population. So I think that's I think maybe a couple of the challenges that we face. It's in no way it's exhaustive, but I think maybe a couple of the big ones. Next slide, please. Um, Innovative strategies and partnerships, things that we found that have really helped us improve outcomes for children and families, is really making sure that as we implemented transitional kindergarten, it wasn't a top down. As many things that happened, it wasn't kind of a top-down implementation. We really wanted to make sure that we heard from local partners, which included both educators, it included implementers, it also included businesses and, you know, folks in our mixed delivery system. So we employed a constellation model, which, you know, involved getting feedback and hearing from implementers about different issues that they may be dealing with, and you know, being thought partners in how we rolled out, you know, messaging, communication, where support may be needed. So that's one of the places where the toileting toolkit came from. So that was, I think, just the partnerships there, and then we have a partnership with in implementing the classroom assessment scoring system in our state preschool program, which we're also seeing some utilization of in transitional kindergarten, and really building systems around that statewide. Next slide. I think I'm kind of running up on time here. So I'll just go quickly around the priorities and goals for the next year. So really it's maintaining access to our UPK despite the budget situation. Our state's undergoing a alternative methodology, you know, process to increase the reimbursement rate that's paid to our early education programs. We're calibrating the desired results developmental profile for 2025. And we're also working on doing a lot of work on curriculum, as I think a number of states are. Let's go to the next slide. I think biggest takeaways is partnerships, having a plan and working with both internal and external partners. And then, you know, it might, you know, you might think maybe a year is enough time for planning and implementation, but realize it may actually take longer. And then I think one of the things is just for us, transitional kindergarten, and being a program that's only available for school districts and charter schools, is kind of creates a little bit of a challenge or tension with community-based programs, and so there's you know, that's kind of brought something for us to work through with local partners. Next slide, and I think we can actually we can go ahead and wrap up the slides here, assuming they'll be available. If not, happy to make them available.
Yeah, Janelle's voice here. No screen. We'll make them available, and we will move on to hearing from Emily in Michigan. Let me get that shared real quick.
Right. Hi, everybody. So nice to be with you. Thank you so much for having me. We can actually start with slide 2, once you're able to share it. Right, thank you. So in 2023, Michigan's Governor Whitmer set an ambitious goal for Michigan to have pre-K for all, which would ensure all 4-year-olds across the state have access to free, high-quality, universal pre-K. Creating a system was no small feat, but we're on track to meet the bold goal. And we're working on expanding access and supporting families across the state. We're not new to this work in Michigan. We built a really strong foundation through our Great Start Readiness program, which has long supported quality early learning. And so pre-K for all was really a natural next step on that journey. The next slide. So the goal of the governor was to allow every 4-year-old in Michigan to have access to free, high-quality pre-K by 2027. The first big step to making that happen was the release of what we call the implementation roadmap. And this roadmap came out of the hard work of the Pre-K for All Action Team, which was a diverse group of stakeholders, state officials who gathered input from over 4,200 Michiganders. We consulted national researchers and looked at best practices from other states. In early 2024, we unveiled this roadmap, which was a detailed plan of how to achieve Pre-K for All in our state. At the heart of Pre-K for All is our Great Start Readiness Program, which I mentioned, but it's not the entirety of our pre-K system. GSRP is what we call it for short, is our main driver for Pre-K for All. And this program has met all NIEER standards for 8 years running. And that's not just great news for kids, it's a real point of pride for our program and for Michigan in general. And then from a policy perspective, it's important because lawmakers want to invest in long-term programs proven to deliver quality services. So our goal for Pre-K for All has been to expand access while preserving the strong infrastructure that Michigan has spent years building. Next slide. So our primary goal is pretty simple, to make sure every child and family in Michigan has access to high quality pre-K programs. Right now, we estimate there's about 110,000 4-year-olds in our state, and our goal is to serve 80,000 children. That's about 75%. For context, the research that we did during our implementation roadmap indicated that highest performing states in the nation reach full enrollment at around 70%. Steve might have more updated data on that. And Michigan is on track to hit this target by 2027. Next slide. So I mentioned our mixed delivery model. We have a strong tradition in Michigan of supporting state-funded pre-K through a robust mixed delivery system. So for nearly 4 decades, we've partnered with our intermediate school districts, sometimes called ESAs or RESAs in other states, local school districts, community-based organizations, and Head Start programs to offer what started as the Michigan School Readiness Program, which has now morphed into the Great Start Readiness Program. In shaping our Pre-K for All model, we've been intentional about including children not just served by these programs, but also those in early childhood special education programs and developmental kindergarten. This approach has given us the chance to better understand the strengths of these programs and challenges of each program type, to learn more about what families want and need, and to focus our expansion efforts on meeting those needs through our main driver of the Great Start Readiness Program. And while all these programs are part of the picture, as I mentioned, GSRP continues to enjoy a mixed delivery system as well, bringing together intermediate school districts, schools, community organizations to operate programming throughout the state. Next slide. You can see that we're making some progress. Last school year, we saw a big boost in enrollment, and we're right on track to meet our 75% by 2027. This year, children are still signing up, and while we're waiting for full data, we already know that by mid-August, over 55,000 Michigan 4-year-olds had signed up for our Great Start Readiness Program, which is a significant jump from last year. When we asked our intermediate school districts what their capacity was for the Great Start Readiness Program, they indicated it was just under 70,000 for this year. Next slide. So addressing barriers. We've learned a lot of important lessons while implementing this work. We know that quality systems don't just appear overnight, they're carefully cultivated, and a high quality system is one that's built to last. Quality is really the foundation for long-term trust, sustainability, and real impact in Michigan. And it starts with putting kids at the center, but it reaches all the way to families, educators, and policymakers. And we've been really conscious that when it slips, it puts that trust at risk, and the trust that keeps families engaged and leaders invested in our early learning system. On this slide, we highlighted some of the big changes we've tackled, but our progress really comes down to 5 key factors. First is expanding a program this big requires strong support from the state to our regional partners, especially our intermediate school districts and pre-K providers themselves. To help new and growing providers get off the ground, we offered flexible startup grants and streamlined enrollment timelines statewide to align with private pre-K providers that weren't participating in the system. Second, Michigan's system depends heavily on our intermediate school districts to help expand access. And so to make sure that classrooms have educators receiving coaching, technical support from a stable source, we increased state support as enrollment grew. So funding for administration isn't fixed, it's tied to enrollment numbers. So as more kids and more families join pre-K for all, ISDs can access additional resources to meet the rising demand. Third, state support must be responsive. We expanded our childcare licensing team to keep up with the new licenses and grew our program staff for our Great Start Readiness program to be more responsive to our regional partners and providers. And then fourth, let's talk about workforce and building capacity in our system. Across the nation, we know there's a shortage of staff and in early care and education, and Michigan's no different. We started preparing for this expansion actually years ago through a program called Caring for My Future, which was funded by ARPA dollars. This initiative helped launch new childcare businesses, community-based businesses, or those in schools, and grow existing ones to expand. And then this year, we're also launching an innovative public-private partnership to boost wages for community-based providers and pilot affordable health, disability, and retirement benefits for childcare providers. And then by bringing providers into the childcare quality system through Caring for My Future, we were able to support the high-quality system that we're building and strengthen the network of providers ready to deliver our high-quality Great Start Readiness program. So this means more options for families through a mixed delivery system. And then finally, we know that investing in communications and outreach is just as important as expanding the program itself. Too many parents still think that pre-K isn't an option for their child, so we've made significant investments in a statewide coordinated enrollment campaign that opens enrollment across Michigan at the same time and really solidifies outreach to families. We've had such success that families that we've interviewed in focus groups want to sign up right then in the focus group. So that's been really wonderful to see. And next slide. I also wanted to touch on the feedback loops that we've created. We've built feedback loops into every stage of our implementation process. So making sure practitioners and key stakeholders have a seat at the table that isn't just one time or something we look at occasionally. It's a priority that we continue to work on, keeps us accountable, and drives continuous collaborative improvement. We call our groups key implementers, key architects, and then we also have lived experience advisors and a lot of early care and learning regional groups as well. Looking ahead to 2026, our focus is going to be on stabilizing the workforce by investing in wages, benefits, and professional development supports, and continuing with our mixed delivery system, continuing to communicate with families as well. And finally, of course, supporting programs financially with those startup grants that help cover the real cost of joining pre-K for all for things like curriculum, materials, zoning fees, architectural costs, staff recruitment. And the last slide. We also know that focusing on pre-K for all for 4-year-olds isn't enough to support the whole ecosystem that helps make pre-K successful for our 4-year-olds. So we're actively putting in strategies to support the entire birth to 5 field. Starting next school year, we'll be supporting a pilot project to offer a home-based Great Start Readiness program. This is in partnership with Homegrown and NIEER. This will help reduce the transitions for families and kids, and will also provide stability for home care providers who worry about 4-year-olds leaving their programs for a center-based pre-K. We've also expanded our state scholarship programs, often called subsidy, to reach as many children as families as possible. And we're growing our supports for infants and toddlers and updating payment policies to increase grants to birth to 3 providers as well. We've also requested additional funding for early on intervention for children who may not be meeting their milestones well before they get to pre-K. And lastly, I mentioned our wage and benefit pilots apply to birth to 3 providers as well, because supporting the whole early childhood workforce matters. And thank you so much for the opportunity to present today, and I'm happy to answer any questions you may have.
Awesome. Thanks, Emily. We will move on to Kimberly in Iowa again once I can get things shared, and then we will open up for Q&A. So if you have questions, you can start adding them to the Q&A box, and we will be heading there in about 10 minutes.
Awesome. Thank you, Janelle. As you bring up the slides, I just want to give a shout out to all of my internal and external colleagues within the state. I appreciate all that you do and the support that you provide me. I couldn't do my job, as many of the other panelists would probably say, if we didn't have those individuals who were supporting us. You're welcome to go ahead, please. So given my first comments, I wanted to start off with, it is hard for me to talk about preschool in Iowa without acknowledging that there are many players in this game with us. We have multiple stakeholders who build our early childhood system across our state. And because of some of our shared responsibilities, whether it's some preschool opportunities exists within the Department of Education. We have preschool and childcare licensing within HHS. We obviously have Head Start and other programs and organizations who make preschool available. It takes the group effort of utilizing resources, coordinating all of the efforts, and really making sure that we provide a broad scope of opportunities to our children and families. Please go ahead. That said, I'm going to start with probably what I know I heard my other panelists share, but also what most of you in the audience are already also feeling too. We are built on a mixed delivery system. It is figuring out how to take various funding streams from different entities and resources to put together and create opportunities, whether we're talking about more serving all day opportunities or full day programming, or we're talking about using resources to provide services to more children, but maybe in a half-day program or in some other program design. These are some of the funding sources that our team at the Department of Ed is frequently referencing and working with in providing technical assistance to entities that are reaching out to us for support or for recommendations of how to build some of the various delivery models they're looking at. But I want to call out, not all of these are at the Department of Ed. So we are constantly trying to work with and collaborate with our other state agencies and other partners in this early childhood system to figure out ways to really provide unique and different opportunities specific to community needs, because every community is a little bit different and they have various options available. Please go ahead. So I'm going to speak to 3 specific programs that live within the Department of Education in Iowa, but I also wanted to envelop in our priority and our work with early childhood special education, as others have. We have 3 large programs: statewide voluntary, shared visions preschool, and early Head Start that are responsible for providing various early childhood experiences across our state. And you'll notice the little asterisks down there with early childhood special education. We prioritize and have really worked to promote inclusive programming. So most of our efforts emphasize the value of serving children who may have unique or varying needs with their same age peers in those inclusive environments with general education curriculum and a diversity of instructional strategies and specially designed instruction. Go ahead, please. So digging a little deeper into a high-level overview, statewide voluntary, we have 324 districts in our state. 323 of them offer a statewide opportunity, which is our universal state-funded preschool for 4-year-olds. Children older or younger may participate, but they do not necessarily receive our funding count for that participation. We have shared visions preschool programs, which are more of a targeted experience, and participation for most children and families is based on some eligibility requirements, looking at risk factors. Of course, we have our national model and presence of Head Start and Early Head Start in our state. We have 18 grantees who are providing high quality Head Start services or early Head Start services across our state with an intentional focus that is that of Head Start, comprehensive services and opportunities to really engage and involve the parents and caregivers in children's lives. And then lastly, early childhood special education. As I mentioned, we focus on and really emphasize inclusive opportunities. We provide professional development in this space. We help programs, whether it's district or community location, to think about how to meet some of the programmatic requirements that are in play for delivery of IDEA, so that we can have children served within those environments that they are spending a majority of their time. Go ahead, please. And then here are the numbers. Oh, one back. There we go. Here are the numbers. We have about 67% of our 4-year-old population in our state is enrolled in our statewide voluntary preschool program, just over 28,000 4-year-olds. There are children older or younger, so that number varies a little bit. But that's about, as I mentioned, 67%. We do know that because we're not the only opportunity in the early childhood system, we have other data that also expands that to represent about 80% of families report that their child has had a preschool experience of some type. So it may not be a program that's under the Department of Education, but it is an early childhood experience nonetheless. We have just over 1,100 children, 3s, 4s, and 5s in our Shared Visions preschool, just under 5,000 in our Head Start, Early Head Start grantees, and early childhood special education, and in eligible children of just over 4,000 who are receiving their services likely in one or a combination of these other 3 environments. Go ahead, please. So these were sort of, when I was asked to offer sort of a look in Iowa, these were the 2 headings that came to mind for me. Our team, our system really looks at prioritizing quality. We want children and families to have high quality services, have high quality opportunities, but we also really do look at offering access. That's one of the details in the indicators in the yearbook that we are proud of, that we are number 5 in rankings in access across the nation. As far as quality, we think about the program standards that are a requirement within our various opportunities. Of course, I mentioned the inclusive practices. We are heavily focused on having our programs, whether at a system or a classroom or a child level, thinking about database decision making. We're doing a small pilot right now in sort of examining additional data outside of what we consider sort of the usual go-tos in an MTSS system around screening. We're looking at some other data sources that may also give us insight and opportunity to think about programming for children. We look at PD, paying attention to resource and evidence-based practices. This is happening in some of our revision to standards activities. And then, of course, I would be remiss, I am mostly speaking to things around quality that are within the Department of Ed, but I have colleagues who are just across the street from me in HHS who are emphasizing and standing up our quality rating improvement system, or IQ4K, and really thinking about quality regardless of where the program is offered and who is attending. As far as access, I alluded to this earlier, we do think about whether we're talking about access as far as a full day program or a longer opportunity for some children who may have unique or different needs, or we're talking about having more children have the opportunity for an experience before they start kindergarten. We look at, as I mentioned, that mixed delivery system and braiding of funding. We look for joint opportunities to capitalize in utilizing our resources across all of those various players in the early childhood system. We have prioritized at the Department of Ed, and we have our other agencies who are right along with us with thinking about a birth to 21 system for IDEA implementation and really supporting unique and diverse needs. And then we are very fortunate that we have had state and agency leadership across various entities that have prioritized and taken action to really provide accessible opportunities to children and families in the early childhood space. We had a bill that promoted and offered opportunities for different types of experiences. And part of that bill, although it didn't pass in its entirety, did come to fruition with being able to offer a grant through our HHS office that offers some partnership options for preschool and childcare in delivering a full day opportunity, especially as one of the other panelists mentioned, for families who may be working or have that type of circumstance or need in their situation. And then go ahead, please. But for me, even though I would say we prioritize quality and access, it's really built on collaboration. We could not exist without the collaborative system that we have with all of the different entities in our state that support the early childhood system and especially our preschool opportunities. We are constantly looking for recognizing, promoting, and supporting joint pieces, joint ownership, and the joint responsibility to make sure we have options and opportunities across our state. And then go ahead, please. So when we have this collaboration, we can create really busy diagrams like this one that are a little bit daunting and overwhelming, but yet they feed sort of the data interest in all of us. This is a map that we have posted on our webpage that represents programming primarily out of Department of Ed or in partnership with others out of Department of Ed, where we can see resources and availability of options for families and children across our state. We really like those red dots because those are our counties of the 99 that have multiple or various options available to families. We are more attentive to and looking for options to really promote and stand up the counties that have more of the orange dot, where they may be more limited based on location, opportunity, or various local circumstances. And then go ahead, please. Because then we get to the really important stuff, child growth, child development. What's the impact of our programming? We have data that we are regularly maintaining on children who are able to meet and exceed age expectations in our preschool programming, whether it's shared visions or statewide. And please go ahead. We get really excited that we have 3-year-old data because that is less consistent across our state and some of our programs, but we can see the growth and support that our 3-year-olds are offered. And then lastly, we are constantly looking at and evaluating what's the growth of our children and our students who have some unique needs as we really push to close that achievement gap. Looking at where are 3- and 4-year-olds in comparison to their peers, and then considering what other options we can make available to really make that experience dynamic and individualized. Please go ahead. So these are our opportunities, and shocking, they're not going to surprise any of you. They are big issues in all of our states. We continue to look for programming options. We continue to look for new and different ways to establish funding opportunities that support and provide sustainability. That's usually one of the greatest concerns that we have is we can make funding available, but when there's not sustainable options, that really affects the importance and the feasibility of some different considerations. We are always looking for options and ideas for our 3-year-olds, whether we're talking about families that have that need for their 3-year-old children, or we're talking about children who may be 3 and have IEPs and are looking for inclusive settings to really receive their specially designed instruction and individualized service. We continue to prioritize transitions, whether it's into our preschools or out of our preschools. Sometimes those are transition options for families because nobody moving through the preschool to kindergarten space is super comfortable, especially the parents and caregivers, and they need support too. We look at innovations and continual opportunities to integrate our various data sources and look for options. We have a really cool partnership with one of our Regents institutions, Iowa State University. Shout out Iowa State. They have the I2D2 system that is looking at how to integrate some of our various data streams and give us a really full picture for children and the services they provide. And then, of course, we all have the teacher provider pipeline. We need to look for options to really continue to support our workforce. Specifically, then here you can see our Department of Ed team is focused on some revision opportunities. I mentioned our MTSS pilot. We're looking at ways to really, as many of the other panelists spoke to too, think about how high quality instructional materials that are supporting evidence or based or promising practices for young children are embedded and available to our providers. And then we are establishing a bit more of a detailed preschool accountability system. We're on the cusp of that, so stay tuned for more details coming. And then lastly, I want to shout out with all of this collaboration, and please go ahead, thank you. With all of our collaboration, with all of our look, we have confidence that children in our state have opportunities. This was a slide that was created for a different purpose, for a different conversation, but it really captured what I felt like the request that I received for this webinar reflected. These are fictitious children in a fictitious Sunnydale Elementary as they enter kindergarten. And one of the things that we have asked our colleagues at the Department of Ed, as well as colleagues in other capacities, to think about what is life like for young children before they come into formal schooling. So we put together, based on our data and the information we had available, if you took the general or the typical kindergarten classroom, how many kids have had an experience? And you can see by the rings or the ovals we've put around them, just with the programs that the Department of Ed is providing, a good number of those kids have a quality early childhood experience prior to kindergarten. And then I want to specifically call out it could be interpreted that those who don't have rings didn't have an experience, and that nothing could be further from the truth. Those children may be in some of our other statewide opportunities, in our other partnerships, and in particular through our HHS childcare and independent preschool programming. So with that, thank you again for the opportunity. I hope that gives you a glimpse of Iowa's experience.
Thanks, Kimberly, and also thanks to Emily and Stephen. We have way more questions that we can answer in the time left. But it's a good list of things for us at the Alliance to think about and think about how we might address them in the future. But I will take one question that was recurring, and I'm going to impose on each of you by giving you 1 minute to respond. But is there anything you would like to say that you think others could learn from your experience, your thoughts about as states deal with budget challenges, which we all know are, if not already on us, will soon be on us? 1 or 2 important things that that you would say about, how to do that? How to address the financing problems that are, if not already on us, will soon be.
Well, I'm happy to jump in. The items that come to mind for me in my quick minute um, would be in our agency and with our programming, our policies have focused on, to the greatest extent possible, looking at community partnerships and other players in the preschool and early childhood system. We are not, Department of Ed is not the only entity that is addressing and providing early childhood opportunities. We are one of many, and we have been and will continue to need to focus on joint opportunities, whether we're talking about fiscal sharing, whether we're talking about partnership and coordinating different types of delivery models or programming types, but also just thinking about if our priority is really ensuring that every child has the opportunity to have an early childhood experience of some type and at some age, we have to look at the broader scope. And so really ensuring that we are working together and coordinating, as opposed to, unfortunately, which sometimes happens with funding, we sometimes fall into our individual silos or our individual programmatic requirements without kind of stepping back and thinking about the full picture that really serves children and provides families options.
Thanks, Kimberly.
In Michigan, I'd build off of Kimberly, of course. We're really invested in our community partnerships and our mixed delivery system. And we're always looking for ways to make best use of public dollars. And we're building a system that families rely on. So right now we have 55,000 4-year-olds in the state of Michigan with an expectation to show up for free pre-K for 4-year-olds. And it's really it's embedded as part of the expectation for Michigan's education system.
Yeah, and I'd say similarly for California, what we see in collaborative partnerships between our state preschools and Head Start, and really making those dollars stretch, and being able to improve the quality of services provided, both the educational services and comprehensive services. And then I think just at the statewide level and appropriating dollars, that comes from the legislature, it's kind of educating. Our legislators are short term in California, up to 6 years in the Assembly and 8 in the Senate. And then, having leadership in the administration that really believes in early childhood. So part of that is electing folks that prioritize early childhood. But then it's also educating to make sure that folks understand the importance of early childhood.
That's great, Stephen. That's actually a good transition, because the main reason the Big Ten Early Alliance exists is to use our resources to help inform policymakers. And with that, Janelle, do you want to close us out?
Yes, thanks everyone for joining, and thanks for your patience on all ends with our tech issues. We appreciate all our presenters, and when you leave today, there will be a really quick survey for you to fill out about the presentation to inform our future offerings. And again, we appreciate you all being here, and we'll be in touch.
And we will make a recording available?
Yes, recording and resources will be sent probably about a week after, just to get uploaded and all that.
Thank you.
Thank you.
And again, thanks to our panelists for being here. We greatly appreciate it.